Tonight on Doctor's Diaries.
I remember getting out and screaming, "Oh my God, is he dead? Is he dead?" as I'm going toward the house.
That may be why the baby's having such a hard time breathing. Yeah, she definitely needs to have that tube advanced.
Her chest is not moving.
What we only dreamed about 20 years ago is available now, easy. You can cure this patient within 10 minutes or half an hour.
I pulled over at the lake in Guilford, put the gun in my mouth and pulled the trigger. And it's all been a blur ever since.
On a cold January night, after a fight with his girlfriend, 22-year-old Ian Olson shot himself in the head. It was the 4th time he's tried to take his own life.
I remember getting out and screaming, "Oh my God, is he dead? Is he dead?" as I'm going toward the house. And just then my husband and a state police officer came out, and my husband is crying, but he's shaking his head no, and I'm trying to make sense of this in the split seconds that it happened. He's shaking his head no. Does that mean no, he's not dead, or no, we lost him, or what does this mean, you know? Then the state policeman said, "No, ma'am, he's not, but I'll be honest with you, it doesn't look good." And then I kind of, my knees went out, and they scooped me up and dragged me in the house.
Right, yeah.
Ian's injuries have left him blind in one eye and deaf in one ear.
Family feud.
The gunshot wound to his head also damaged the brain's frontal lobes, affecting Ian's behavior.
As far as his personality, what's changed?
Well, he still has that sense of humor. That was my biggest concern. I thought if he's going to come back and be terribly flat and have no sense of humor, we might better have lost him, because that was his calling card. But his sense of humor is with him. Thank God for that. But he, you know, we've been through the adolescent thing once already, and now we're going through it again. Care to show your armrest to the camera?
Sure.
You don't have to give the details, but this is what he looks like. See, and it fits so comfortably. Oh, I do think I'm going to faint.
Oh, goodness.
This is where they had to take out some of his skull, right around here. The bone was infected as well, so Dr.
Be a little candy dish.
Yeah. Wise guy.
Or an ashtray.
We've come up with several uses for that depression in his head.
Does it hurt?
No, it doesn't hurt at all, actually.
Ian will eventually undergo surgery to reconstruct his skull. But before doctors can do that, Ian's neurosurgeon, Dr. Deborah Benzel, must operate one last time.
We're preparing to reopen him and put another layer of seal between his brain and his skull to complete the rebuilding of his skull base with muscle and tissue from his body. Once we complete this rebuilding stage, he will be prepared for the final stage, which is to rebuild his forehead with a piece of bone.
Rebecca, did baby Hannah leave for the OR yet? She did? Yeah. What time is she coming back? Is anybody here?
Chris Casal is a nurse practitioner, which is a registered nurse with advanced training. She has worked in the neonatal intensive care unit for the past 12 years.
You do see many things that are heartbreaking, and you do spend a lot of time crying and feeling a lot of sadness and grief that you share with the families, and it's all part of it, and it's all very humanizing. You know, I do a lot of praying every day for all the families and all the babies that I take care of. This is our baby. This is Dr. Rifkinson. Hi.
Chris's first patient today is a baby girl, Azaria Hannah. Azaria was born 13 weeks premature, and that may be why she is now suffering from hydrocephalus, a condition more commonly known as water on the brain.
Hydrocephalus is just the accumulation of fluid around the brain, and that's when there's some kind of obstruction that prevents the circulation of cerebrospinal fluid around the brain and down through the spinal column.
Azaria has just returned from the OR, where a neurosurgeon has inserted a draining device at the top of her skull.
All right, I'm just going to come in. She has a blockage in her cerebrospinal tract from an old bleed. So this is a reservoir that they'll be able to tap to take any excess fluid off, fluid that can't circulate around the brain. Actually, Kathy, you know what? Can you go up to like AC 6? Yeah, go up. We'll shoot her up to like AC 50 or AC 60 because she doesn't have much effort. Huh? Sounds really tight.
As Chris checks Azaria's vital signs, she realizes the baby is not breathing properly.
It's probably high.
Looks like it's at 6.
It's,
I mean, if that's 8.
yeah, you might be.
That looks like a 2.5.
And her chest
isn't moving at all.
Too small. So let's just, I'll just redo it. You want to take it out? I'll take it out. Just grab me a blade. The baby was initially intubated by the anesthesiologist in the operating room, and then during the transfer back, the tube may have slipped. So upon her admission back into the NICU, we needed to replace the breathing tube. You might want to just connect the O2 on the bag. Thank you.
Her chest wasn't even moving when you put her on the
Your
bed.
chest is moving now? You going around again? Alright, let's try this. I think so. No, I'm probably deep. Hold on, I can't see the level on that.
I know, but the number's on the other side. It's hard for me to reach across. I think probably 8.
I'm not convinced.
I hear louder on the right.
Okay. Well, I'm at like 7 now.
That should be high enough.
The laryngoscope is on the bed.
Okay, I feel it. Thank you.
You're welcome.
Good job.
So I just earned my lollipop.
Yeah.
As Ian Olson packs for tomorrow's surgery, he's unfazed by the upcoming operation.
So you're not nervous at all about tomorrow?
Not at all.
Why not? Isn't it something that would be nerve-wracking?
Yeah, but I mean, I've had so many surgeries already that it just doesn't matter.
It's early in the morning, and Ian leaves for the 3-hour drive to Westchester Medical Center.
You gave her 0.25 and 3, right?
Yes.
When Chris Casal checks in on baby Azaria 30 minutes later, she realizes something is still very wrong.
Oh, 77, what the heck? You know what, take a listen while I'm putting some tension on the tube. If she's ice cold, that's going to be it. You want me to get a half of her?
Yes.
So maybe that's why.
But I try not to go in here. She is cold.
Yeah, she's chilly. 60s, man. What's her story?
She's got a big plug in there, that's her story. Okay. You ready?
Even though her breathing tube has just been replaced, baby Azaria is struggling for air.
Virginia, can you ask Rita to page that radiologist? What? Ask Rita. You did? Have her page him again. I want him here like now. Because we can't wait for this. Did X-ray just leave, guys? Just left now? Let's just take a peek. I want to just see if you can see really quick. Here. Hannah. Well, see, her ET tube looks like it's high. We might need to reposition this tube, put it down. The film is a tiny bit rotated, but you can see that this is the tip of our endotracheal tube here, and it really should be midway between the clavicle and the carina. The carina is the spot right before the two mainstem bronchi branch off, right and left. So you can see it probably needs to be advanced a little bit. That may be why the baby's having such a hard time ventilating. Also, yeah, she definitely needs to have that tube advanced. Okay, Mrs. Hannah, the ET tube on the baby is a little bit high, so we're going to have to put another one. Take this one out, put another one in. I could advance it, but it won't be optimal. To do that, it's better just to replace it. Yeah. Okay? Just bag her for a bit. Just bag her up a minute. All right.
She's not correlating.
She'll bring her heart rate up.
not correlated. No, first of all, her heart rate is not 240.
Her chest is not moving.
Because of how big her belly is, when I suck her up.
She's totally clamped down. She's totally
your time.
clamped.
You got time, you're okay. In?
Yeah, I just can't see the level where I'm at.
Oh, that's all right. Just take get this on there. You're about 9 at the lip.
So we're a little deeper now.
Yeah.
I'm gonna just change those ECG leads because she's totally clamped.
Beautiful.
Well, beans, girl. You just want another piece of candy, huh?
It was like a dime size, and now it's a little bit bigger than that.
All right. Can I just take a quick listen?
Please do.
No, I'm sorry. I really listened. One listen is enough. Good. Thanks, guys. So, like, half an hour, Virginia? Done. Man, it's intubation day today. It's just completely overwhelming. IV tubing and ventilators. And I don't know how you can ever thoroughly prepare a parent for that, but one of the biggest skills of the NICU nurses is to sort of guide the parents into seeing beyond that and finding their baby. So we're doing good, Mom. It's just a waiting game until she wakes up a little bit, okay? Once she wakes up a little bit more from the anesthesia and starts breathing more on her own, we'll know because she'll start to fight that respirator much more than she is now. She's wiped out. You can see she's just letting the machine do pretty much all the work for her. So she's going to definitely let us know when she's ready to come off of this, that's for sure. My guess would be tomorrow. Yeah. Probably tomorrow, you know, tomorrow late afternoon. Absolutely not. Nope, absolutely not. Most babies that do go to the operating room need like 24 to 48 hours on the respirator before, you know, they're ready to come off and do all the work. It takes a lot out of them, you know, it really does.
Laura, are you finished? Are you playing?
Okay. Seems like she definitely likes the new tube. Right. Yeah, they'll take another extra. Yeah, I don't know when, but we put the order in for it anyway. Okay, you're welcome.
Coming up next, Chris Casal must put baby Azaria through one more procedure.
We see the worst of the worst, and we see it every day.
Hi, Dr. How are you?
74-year-old Conchetta Rollo has a malignant tumor on her liver, and without some kind of treatment, she will not survive. She's being cared for by Dr. Grigory Rosenblit.
By no means she is a candidate for any kind of big surgery, even the liver transplantation is a large surgery. She probably will not survive it. Her medical condition otherwise would not allow her to be operated upon with the good results.
Instead, Conchetta is undergoing an experimental treatment involving one simple ingredient, vinegar. Dr. Rosenblit hopes this procedure will help control the growth of her tumor.
Well, you know what we're going to do today again. Yeah. Remember what we did last time. Remember we injected this vinegar?
You're sure? No, I mean, no.
We're not sure. You're right. We don't know whether it is there or not. We may or may not inject, depends.
Because I want to go far, I want to eat.
I know. It's a good sign that you're eating now. It is really, I'm happy that you gained 6 pounds. You look much better to me. I describe to them every part of this procedure. I tell them that it is an experimental procedure. I explain why. I explain to them how it works, why it works, what are their chances. And that's all I can tell to the patients. And many of them very much understand, and many of our patients, frankly, do not have many options. Today we will look at your liver again,
Yeah.
Joanne and I, and we will see if there is some tumor left there. Then we will again inject the vinegar, exactly as we did last time. If we inject, you will stay overnight, probably. If we don't, he will go home and eat.
Eight.
Yes, keep eating. All right.
Okay, so I'll be waiting.
Sure. Any questions, anything? No?
No, I think another procedure, basically.
Yeah, you already know it.
It's been a piece of cake so far.
Good.
But I'll wait for you to
Sure.
give me the news, okay?
Of course. I'll talk to you.
Stay all day tomorrow because I'm not eating here.
You can eat this food? Most of us like what we do. We like this contact interaction with the patients, their families. So I think it's very interesting. It is exciting and gratifying because often you can help your patient very, very much. All right, I'll see you in a second.
Okay, Dad.
They only have one size gown?
Yeah, one size gown.
What size gloves?
6.5. Here we go. Deborah, you have a warmer for me? Let's do it.
Now that baby Azaria is out of danger, nurse practitioner Chris Casal is able to treat her hydrocephalus. She uses the reservoir cap to drain fluid from the baby's head.
Just keep her flat instead of her head of her bed up. We'll just leave her flat on it. If her head is up, her fluid is just going to drain this way and it's going to sink even more. So if she stays flat, it'll just give it some time to equilibrate. Azaria does produce fluid quite rapidly. We'll continue doing these taps until she meets the weight requirements necessary from the pediatric neurosurgeons in order to have a more permanent fixture put in. You want the other lights on? And I just put a small 25 gauge butterfly needle into that reservoir there, and through that reservoir I'm able to pull through the spinal fluid right from the ventricle. See how it's going already? Oh, yeah. Here you come. I am going to pulse right now. I'm going to stop at 15 because you see how she's sinking already?
Yes, I do. I do. It's Martha. I think that's a good choice.
I don't see any leakage anymore. So you replace this with 5 cc's additional PO over the next 3 feeds?
Yes.
See the difference?
Yeah. She was very bad this morning.
Yeah?
Really.
So we'll see how she does.
Ellen
this
said all
afternoon.
morning all she did was be sad.
I mean, it makes sense. I mean, if she's got buildup of pressure, definitely. Looks great. I mean, I bet you the protein counts are coming down.
How did you know where to go?
Because you can see it's right here, the reservoir.
All right, I see that.
Right, and then this piece here has a screw
right.
at the base of it, and this can be transferred. This particular appliance can go to a VT shunt. She can just change this to a shunt because of this little screw here. So it's like it's like this with a piece here. This is the reservoir itself, and then the rest is the adaptable piece. And we forget, working here in a high-risk medical center, that babies are born every day normal, healthy, because we see the worst of the worst, and we see it every day. When you go through experiences like that with families and with patients, it just becomes special, I guess.
It's a pleasure doing business with you.
Oh, likewise.
For more information, log on to our website. Next, Dr. Benzel has to use all her skills to reconstruct Ian's skull.
The whole base of his skull was shattered into about 500 pieces. Yeah, it's amazing how much hair he grew back.
It's 8 o'clock in the morning, and Ian Olson is being prepped for surgery. The operation, performed by Dr. Deborah Benzel, will help repair the damage he suffered after shooting himself in the head.
He damaged all of the bones at the base of his skull, and he damaged both of his frontal lobes. And basically, you know, from his nose on upward, instead of being separate cavities, the sinuses and his brain, they all just sort of opened up and became one big cavity. An average brain operation, it probably takes about an hour to an hour and a half to get it set up. So if it's a 7:30 case, we would normally be making a skin incision somewhere between 8:30 and 9 o'clock. That's pretty standard. We'll put the cranial drape here, and just leave it folded. Okay. Charles, nice to meet you, Charles. I'll have you know I'm horrible with names, so I'll probably call you Sir or Sweetie. That's my favorite, right? Sweetie's okay? That's nasopharynx. We found that he still has a very small leakage of air from his nose up into his brain. And if the air can leak up there, then we also know that bacteria can. So before we can reconstruct his skull, we have to seal off the remaining opening area. I'm coming. Anytime that you have to manipulate the brain, there's always a chance you can get brain damage. He's already suffered some damage, so while his risk is quite low in general of suffering additional brain damage, because he's already had some, just a little bit more could obviously leave him with significant deficits. When I started training in neurosurgery, there were, less than 30 or 40 women in the whole country who had ever trained in neurosurgery. So we were really blazing new ground. It's been, pleasant many times to be in the operating room doing a complex case, such as the one we're doing with Ian, where the plastic surgeon, the otolaryngologist, the anesthesiologist, the neurosurgeon, and the neurosurgery resident were all female. Truly a fairly unique combination of female talent in a room at one time. We do have to open up his brain again. We have to go through his nose, and then we're going to have to make another incision either in his arm or his chest or his rib in order to get our grafting. So he's going to have a lot of incisions. Also, the cranial incision that we're using has been opened a minimum of 6 times now, and the scalp is resilient, but there's always a chance that that wound itself will never heal completely. You have to understand that the whole base of his skull was shattered into about 500 pieces, and we have been sequentially rebuilding that using a combination of muscle and bone. So this is now the fascia lata we took from his leg, and we're about to make it into dura, the changing leg into covering of the brain. Can you give B some scissors, please? For my practice, and for many of us here at the medical center, we're really seeing the extremes of neurosurgery. We're treating a lot of brain tumors. We're treating a lot of devastating traumatic injuries. A lot of our patients do get better, but a lot of them don't. So you can take patients who are on the brink of dying and bring them back. And all you have to do is do that every once in a while. The ones that you lose, because there's really nothing that you can do, it balances them out.
Before Conchetta Rollo can be treated for a liver tumor, Dr. Gregory Rosenblit needs the vital information provided by a CAT scan.
We have to, first of all, we have to find out whether the tumor is still alive or what part of the tumor is still alive. We have injected already 2 times acetic acid in the tumor, and certainly some part of this tumor is already dead, maybe all of this, but we don't know until we do the CAT scan. Let's see what we have today. This black part is probably dead. The white part of the tumor is probably alive. It is like a ball.
Okay. So kind of like a golf ball?
Bigger.
Bigger than a golf ball.
Yep.
Bigger than a golf ball. Maybe a cue ball?
What do they play baseball with?
Yeah, maybe baseball.
Yeah.
Baseball.
I'm a foreigner. I'm not supposed to know what they play baseball with.
What do they play in Russia?
I don't know. Oh, football, which is called soccer in this country.
All
That's
right,
what
it's
they
not
do.
a soccer. No,
Okay.
Not a soccer ball.
After determining that part of the tumor is still alive, Dr. Rosenblit prepares to inject Conchetta with the vinegar.
We will see. I put a needle there, a small needle, to see where it's correct place to put the bigger needle or not. What we only dreamed about 20 years ago is available now, easy. Just go, buy it, and use it on your patients. And then here, instead of big surgery, a big scar, 10 days in the hospital, you can cure this patient within 10 minutes or half an hour. We're in the right spot.
That was still the lower end. That's the acid?
Yeah. Vinegar. Just clear fluid, it's nothing. Smells like Italian dressing, that's all. Stop. No, see, this is our injection right here. This blood pink is totally injected again. The results are so good that weighting the risks versus benefits gives us tremendous assurances that this kind of treatment is very good. Very good. We'll see in a month. See her in a month.
Okay.
Thank you very much, everyone. I can't do anything alone. None of my colleagues can. We all work like a team. We're very close, almost like a family. We meet socially and we like each other. It's not possible to work in such a close environment doing the same work together without liking each other.
We're going to take you back to the ambulatory surgery place where you started, right? And you can see your daughter. And you're going to stay overnight, okay? Okay. Right. You okay?
I want to go home.
Just ahead, dealing with the unknown.
The most frustrating thing is when a parent asks you right from the get-go, is my baby going to be okay? Is my baby going to survive? Well, maybe we'll go see a baby while we're waiting, right?
Nurse practitioner Chris Casal is concerned about Lindsay Ulick, a baby girl born 7 weeks premature. Lindsay also suffers from hydrocephalus, or water on the brain. Unlike baby Azaria, who had a blockage in her spine, Lindsay's condition can be more easily treated with a simple spinal tap.
If it should look like her head should start to grow at a more alarming rate, or this fontanelle should get really full and tense, feel bulging or elevated when I run my finger over it, these are reasons why we would need to tap her again, just to take some of that pressure off.
Complicating the baby's care is the absence of her mother. Lindsay's mom contracted an autoimmune disorder and almost died during childbirth. She's still in the hospital, and Lindsay's father must now care for both his wife and daughter.
Yeah. Okay. You need something?
No. Can you talk to the unit?
Yeah, that's what I'm going to do now.
Good.
I'm going to do another tap while I'm up there too. Okay? The most frustrating thing is when a parent asks you right from the get-go, is my baby going to be okay? Or is my baby going to survive? And those are questions that you really have no answers to. Certainly the first initial hours and first initial days are the most critical in the NICU period. So it seems like, she's doing fine. She's growing nicely and her vital signs are all stable. So these are good things. It's not like, the tap is anything really emergent at this point, but we just don't want any more, excess buildup of that fluid.
Right. I mean...
Okay, we were going to try and do it every other day or every third day, but she suggests today that we should do it.
Okay.
So.
The next step in the process, should it not correct itself, or should it, I guess, essentially not be a change, would be the shunt?
Right.
Okay.
Yeah.
Okay.
They will definitely have up times and down times. So I usually like to tell parents to proceed every day with cautious optimism and never to have them lose faith, because a lot is lost when faith is lost.
Well organized with that.
Talk with you later. Okay.
Thank you very
You're
much.
very
I really
welcome.
appreciate it.
Bye, Kyle.
Really appreciate it.
See you
I'll be
later.
talking to you soon.
Oh, you bet. Okay. All right, let's go see Lindsay. Lindsay. Not 1 miles and 23. Ah, bingo. Okay, then all we'll need is betadine. Okay. And I'll have to scrub. Oh, she's getting so big. You just need to put on a cap and a mask, okay? Okay, ready?
She's fine.
Is Ramaswamy back?
Let's go.
Yeah.
Check her out.
It's been 24 hours since Conchetta's procedure, and Dr. Rosenblit is trying to determine if she's well enough to go home.
Now you're very hungry, right? You ate? You did? Now, are you hungry now?
Yeah.
Still hungry? Good. You look good. Let me see you.
Hungry for macaroni.
From pasta. Pasta is the best meal. Pasta. Her liver problems are not so significant as to jeopardize her even lifestyle. She essentially can eat normal. She can walk normal. She doesn't have a prominent problems with her liver. That's a tumor which is her problem. If we are so lucky and successful as to completely destroy the tumor, she has very good life expectancy and normal life ahead of you. And we will do our best to do exactly that. You're going home. I'll see you in a month. 1 month. I'll see you again.
I can go home.
You go home? Yes. You go home. Eat pasta, macaroni.
Thank you very much.
Very good. I'm happy that I see that I can do something for that person. Otherwise, this person is in a desperate situation. It gives you pride and joy. Nothing can replace it. Neither salary, no big money, rewards, medals, nothing helps. But this is really, when the patient goes and away from you and you help a patient, it really helps a lot.
For more information, log on to our website. When we return, the sound of depression.
Through my childhood, hoping I wouldn't make it to 22. Here I am, alive and screaming.
We're going to do a lumbar puncture on baby Lindsay in an attempt to drain some of the cerebrospinal fluid off through her spinal column, so hopefully we'll be successful.
Okay, Lindsay. Okay, switch around.
Okay, what we're going to want is her spine straight, like the way it is now, but I want to have her hips flexed up and her shoulders rolled this way. Okay, so she's going to be like in a fetal position, curled up.
Over here.
And what you need to do on your other side, if you can hold her hips,
I'll show you.
it'll prevent her legs from moving.
It's kind of like, and a lot of people describe it as a C.
C, correct.
And then Chris will say, just lift her so I can get.
Yeah, the sterile field
And I'll
underneath her.
watch that. Okay, you comfortable? All right, go right ahead.
If I need you to flex her, believe me, I'll tell you.
Yeah, and I'm right here too. So.
Kathy, you have one free hand?
Yeah.
Just
which way you want?
push this down.
Okay.
Thank you, thank you.
How's that?
Perfect. Well, she knows.
Yeah. And she will cry.
Kathy, I may ask you to massage her fontanelle also.
Okay. All right, sweetie.
Okay, are we ready?
Okay.
Beth, you got her good? Because we're gonna.
All right. Okay, sweetheart. Okay.
That's it. Good. Now we're gonna want to just take off as much as we can. Okay.
Right.
So this is just gonna be patience. I think we have nice, like golden CSF, so that's good.
Yeah.
Nice tap, and tap is always reflective of the people that hold. So good job.
Yes.
Now you do a little bit of massage to that anterior fontanelle. That's also going to help the flow of the fluid, okay?
You have her next now? I have her, if you don't mind rubbing her front.
Great job. Great job. Excellent. See, it's coming nice and quick. Good job. I have excellent helpers today. It's hot in here. It's about 150 degrees.
Well, it's even warmer with us. With the
Anybody got a pina colada?
That sounds good.
That's what we need.
I'll take a still, yeah.
Yeah, right. Margarita, something. Nice big Corona.
It's okay. It's okay. It's almost over.
Well, the worst is over.
Yeah.
Lindsay, girl. The first time I did this, it was very, very, very dark, tea-colored. Really looked like old bloody stuff. So this does look better.
Yes.
Good girl, Lindsay. This is probably making her feel better. I mean, any buildup of CSF is likely to give her a headache, although, you know, it's hard to quantify a headache in a baby pain, but if you or I had this buildup of CSF, you should be sure we'd be having headaches. So any decompression of that fluid is definitely going to make her feel more comfortable. Catheter goes back in, the needle rather goes back in so that when I pull this out, no epithelial cyst forms around.
Okay, Lindsay.
We got 8, 9, 10, 11, 12, 16. I'm going to say, what, 18 cc's?
You look great.
She is way cute.
She probably
You know what?
feels so much
After that
better.
tap, she's wide awake.
Oh my God, look at her face. She's so cute.
Oh, let me seal her for a minute. Come here, sweet love. Oh, you are a precious girl. See, she's sunk. See how sunk she is? That's why I would rather have her like this if we can. Okay, baby girl. Hey, you feel good? You feel good? You're a sweet girl. Yeah. You are so sweet. I'm sorry I had to do that to you.
3 days after the surgery to repair his damaged skull, Ian Olson is well enough to talk.
So, how you feeling?
I feel fine.
Yeah.
Yeah. My head's a little swollen, but
What part of it is?
over here, still a little tender.
What does it feel like? I can't even imagine.
Just mushy. Oh, there's muscle in there.
So where did they take that muscle from? You said you thought it might be coming from your arm.
Yeah, it turned out that they operated and took ligaments from my leg. So right here is all cut up. I think this is where they took bone from. They took muscle from my back. I was hoping I wouldn't make it this far.
You were hoping?
Just through my childhood, hoping I wouldn't make it to 22. Here I am, alive and screaming. Sucks.
Those of us who don't suffer from endogenous depression cannot comprehend what it's like to feel like that. I mean, these people suffer from a sadness, a coldness within themselves that we can't touch. We can't comprehend, those of us who don't suffer from it.
Are you going to do this again?
What, try to kill myself? I don't think so, but I didn't say it 5 years ago when I tried it.
Certainly he needs support for whatever caused the suicide attempt, whether he needs medication or other kinds of support. That will probably be something that he will need for the rest of his life, or certainly for the foreseeable future.
When we come back, Chris shares a special moment with Lindsay.
This is definitely going to be the best part of my night. Human touch is just so important. Right? right, let's go see Lindsay. Oh, I forgot her bunny. That's the hole, right? Oh. That's that human touch. I'm looking. I've been carrying this thing around for 2 days.
Where you got it for her?
Yeah, I went to a little conference and... Oh dear. Did I lose it? No, it's in there. Did you see it? I did, it's in there. Here it is. Oh, Lindsay's bunny. They were giving away stuffed animals, you know, and of course as a professional nurse practitioner, the one thing I need is a stuffed bunny, so
what
I'm going to share with Lindsay. Because it's sweet and so is she. Oh.
It's been 6 hours since her last spinal tap, and Lindsay is sleeping soundly. As the nurse practitioner, Chris Casal must constantly monitor the baby's condition, commonly known as water on the brain.
And hear and see how her head feels. You know, we monitor this anterior fontanelle, which is the soft spot in her head, and we look for that. If there was any buildup of fluid, cerebral spinal fluid, it's likely that this fontanelle would be very full when you feel it bulging. And while Lindsay's at rest, not moving or crying, her fontanelle is nice and soft, actually flat, which is a very good sign. She gets 1 teaspoon of rice per 30 mLs, right? Do you have a bottle prepared for her, or you need to make one up?
I didn't prepare anything.
Okay. Peanut. Hi. Hi, sweet girl. Hey there. Got you all? Hi. Say hi to everybody. Are you going to want to eat, huh? You're going to have to eat something, sweetie. Yeah. Oh. Hey. Peaches the color. Lindsay, you're out cold, girlfriend. There, Peanut. Look at you. You didn't even know what happened. Somebody shoves a bottle in you. Look at her go. Oh, my God. Oh, that's delicious, isn't it? Yeah. Yeah, Liz. Yeah. That groggy look in her eye like, oh, boy. Doing this again? Boy, she should be the champion. Stellar. Beat her. She looks so sleepy. Big sigh. This is definitely going to be the best part of my night. No doubt about that. You know, there's definitely times in your night where, you know, you'll do something heroic like, you know, save a baby in the delivery room or, you know, save a life, period, anywhere. Do some skill or perform some procedure that is life-saving for a baby. And yeah, that feels great. And it feels good to do it and to do it successfully and have there be a good outcome, but nothing ever replaces this, you know? Human touch is just so important, right?
Getting close.
It's been 48 hours since her last spinal tap, and Lindsay and her mom are both well enough to finally go home.
How's it feel to be getting out of here?
How's it feel? It feels wonderful. Nothing else like it. Got excellent people here. No, not excellent, astounding people here. Nurses, doctors, and everything else. They definitely performed the miracle for my wife and for my daughter.
As is the case with most premature babies, doctors will be on the lookout for developmental problems in Lindsay's future.
She will need definitely close follow-up with her neurologist, close follow-up with her neurosurgeon to see if she may need further spinal taps at home. But those questions, obviously, I can't answer. That's going to need to be followed up by the consulting services once she's been discharged.
Daddy.
Yes.
Why are your eyes red?
Because I got happy tears.
For what?
Because we're all finally going home. We're all going to be under the same roof as a family.
Mr. Ulick really had to carry the brunt of all of this, not only his baby's illness and complications from being born prematurely, but also with his wife's illness, which was really, really devastating for him. He had to run a household, care for his other children, and then make himself available to both his wife and his daughter, who were both hospitalized and really quite ill. He was just an amazing, amazing man.
Chris was incredible. Through it all, being here alone, staying a few times with Lindsay. You know, she was very supportive in coming over and understanding that I was going through a tough time. So she's not only taking care of my daughter, she was also kind of guiding me.
Get her out of here.
Westchester Medical Center, thank you very much for keeping my family together, for keeping us all alive and getting us back together. Thank you very much. You've all performed a miracle for me. Thank you. Good night.